Miss Lydia. I'm going to be your nurse today. Can you tell me your name and date of birth?
Avelia Cabrera, November 14th, 1992.
Okay, I'm verifying that with my paper, which is correct. Okay, so let me just wash my hands first, okay? So I'm washing my hands. I'm going to gather my equipment. I'm going to go ahead and just do a listen to your lungs and your heart while you're here with us, okay?
Okay.
So I'm going to start by listening to her lung sounds. And let's go ahead and check your bronchial. No adventition sounds heard. I'm going to go ahead and assess the rest of her lung bases and other lobes. And I'm also listening to the bronchiovesicular sounds and the vesicular sounds as well. So I'm going to start in the front. Take a deep breath for me in and out every time I place the stethoscope, okay? Okay, another deep breath. And I'm going to go under. Is that okay with you?
Yes.
Okay. Deep breath. I'm going to assess the right middle lobe as well. If you mind raising that arm, taking a deep breath for me also. Okay. I'm going to go ahead and move to the back if you don't mind turning for me. Okay. Deep breath. Almost done. Now we got to assess that right side again. Deep breath. Okay, very good. And since I'm on the back side, I'm going to go ahead and assess the rest of her respiratory part by doing checking for the chest excursion and chest fermentis. So I'm going to place my thumbs at T9 and T10 and kind of pinch up a little bit. Now I'm going to ask the patient to say 99 as I'm going up. Every time I place my hands, if you could please say 99. You can go ahead and start.
99. 99. 99.
Okay, so for tactile fermentis, it is normal. I'm going to go ahead and check the chest excursion. If you can just take a deep breath for me, in and out. Okay, and the rise and fall is normal. All right, if you don't mind turning back around for me. I'm going to check the chest fermentis in the front. So let's start at the bottom. Say 99 for me again.
99. 99. 99.
Okay, and one more time, the chest excursion, rise and fall, please. Take a deep breath. Okay, so as I'm doing this, I'm also observing her chest shape and the rib placement. It looks normal. The chest and the area of her chest here looks normal, no round or barely noted. Her respirations are even, unlabored. They were clear in all the lung lobes. And then I'm gonna go ahead and just listen to your heart as well, okay?
Okay.
So I'm gonna start with aortic, then pulmonic, Erb's point, the mitral. I'm sorry, this is a tricuspid one, and your mitral. Okay, so S1 and S2 is heard, normal is present, but I did not hear any abnormal S3, S4 sounds, and no murmurs were heard as well. Now I'm going to go ahead and assess her carotid areas. So that is 2+ normal. As I'm doing that, I'm observing jugular vein distension to see if that is present. And I have not noticed any. So I'm going to go ahead and move on to the rest of her pulses. Brachial, that's 2+ normal. Her radial, 2+ normal. And we'll do the other side. Brachial again, 2+ normal. Her radial, 2+ normal. And I'm going to go ahead and assess her feet down here. I'm going to look for edema. None was noted. Check at the bottom. Now I'm going to check her pulses in her feet, which at the bottom it's going to be her posterior tibialis. And then also we're going to look for the dorsalis pedis, which is between the thumb and that second toe. And kind of just start up until I find it. Same on the other side. Okay, so I did not notice, and these were also 2+ present in both dorsalis pedis, and we'll do this one again. That's your posterior tibialis, 2+ present in that one, 2+ present in that one. No edema were noted, or in the arms. Okay. Now I'm gonna go ahead and move on to the breast examination. I did notice as I was looking at her chest that they were normal, symmetrical, and there was no abnormality in the contour or the shape of it. Now, have you noticed any breast discharge or redness?
No, I haven't.
Okay, very good. Now, do you check them at home? Do you normally do them?
Not really. Just kind of when I remember now.
Okay, well, I'm going to go ahead and just kind of go over it with you,
Great.
what a breast exam is. You
Okay,
want to
good.
do it once a month. Typically, what you would like to choose is around your menstrual cycle, or when you're having your period. Your breasts are a little bit more tender and you're able to feel any abnormalities or lumps. When you do that, now you can either do it when you're going to take a shower or if you're going to go to bed, because either option with the shower, it makes it easier if you have soap and water to glide over the breast, or if you're lying down in bed, you lay down and it kind of flattens out the breast tissue and it evens it out where you can feel the abnormality a little bit more easier if there's any lumps.
Okay.
But let's use the example of going into the shower. You're going to stand in front of the mirror and you're going to look in front of the mirror facing forward. You're going to observe your breast to see the symmetry, that they're the same area, same length. You're going to put your hands on your hips and observe for any abnormality in the symmetry. Now you're going to look at it as well, observe the skin to see if there's any redness, if there's any nipple discharge or nipple inversion. And what you want to do as well is raise your arms together. You look again for symmetry, but then you're going to look at the breast ridge and see if there's any abnormalities.
Okay.
And then once you did that part of the exam, and I think I mentioned, but the dimpling, I always like to use the example of like an orange. If there's any dimples in the breast, that's usually not normal as well. You want to know for that. But once you get in the shower, you want to examine one breast at a time, and you want to use 3 fingers and use the actual pads and not the tips. But you're going to raise one hand above your head, and you're going to start on the outside of the breast and work towards the nipple around in a circular motion until you get back to the starting point. So you're going to start with the 3 fingers and your pads, and you're going to work from the top down towards the nipple. And you want to make sure you start up higher and get around the axilla or your armpit area, because it also has breast tissue and you can have lymph nodes. You have lymph nodes and they can find some enlargements or nodules in there as well. So you work your way around and you do that once a month. Now, even though because you're doing this, you want to make sure your doctor does it as well.
Okay.
Do you have any questions?
No, I think you did a great explaining it to me.
Okay, very good. And then the rest of the education teaching topics that I would do with my patient or a client this time, I would do sun exposure. As I was doing her assessment, I noticed some moles, so you want to talk about sunscreen in that. I want to do importance of water intake and visual examinations. Flu season is on, so I would talk about the flu vaccine, and then I would make sure the physical or annual examinations with her, and I would probably also do the importance of sleep. I know. That was it for my examination today. Thank you. I appreciate it. So I washed my hands and we finished the exam.